Hello viewers, myself Dr. Vishal Chafle. I am consultant and intervention neurologist practicing in Apollo Hospitals, Navi, Mumbai. Today we will discuss in brief about Parkinson disease. Parkinson disease is one of the common neurodegenerative disorders. In this condition, person develops tremors of the limb, postural imbalance, slowness of activities, handwriting becomes slow, and there are various other symptoms also. This is a disorder of elderly. Mean age of presentation is around 65 to 70 years, but there are certain forms of Parkinson which they do occur in young population. We call it young onset Parkinson disease. As I mentioned, this is a neurodegenerative disorder. So there is a neurodegeneration or degeneration of the cells in particular part of the brain. These cells produce important neurotransmitter called as dopamine. This is important in maintaining the neurotransmission, which ultimately maintains our smoothness of the movement, like speaking, walking, writing. So when a particular part of that cells get degenerate and that particular part of the cells don't produce dopamine in adequate amount. This is a gradually progressive disorder, and at certain point of time the dopamine quantity produced is very less, and at that time patients start developing symptoms of the Parkinson. So symptoms of Parkinson can be generally start from the one side, but it can be bilateral, or it start from one side and then become bilateral. Person may develop tremors, they may develop slowness of activity, they develop difficulty in maintaining the posture, and they find difficulty in turning, which requires a lot of postural control. Their handwriting becomes slow. These are the visible symptoms. Apart from that, there are a lot of non-motor symptoms of the Parkinson's also. Like urinary control may not be proper, they may develop sexual dysfunction, then there are reduced smell, then there are certain behavioral changes in advanced form, and sometimes in early disease also some person may get some behavioral changes. Then there are some sleep related problems like REM behavior disorder, where excessive talking or walking or excessive dreaming in the sleep is very common. So these are the various symptoms of the Parkinson. Non-motor manifestations or non-visible symptoms, they may appear very early in the form of disease, even before starting the motor or visible symptoms. So Parkinson disease is one of the slowly progressive disorder, and diagnosis is generally clinical. So there are certain sets of the clinical signs and symptoms, and that's how we diagnose the Parkinson. But when we diagnose the Parkinson, we have to make sure whether it is Parkinson disease or whether it is atypical or other variety of the Parkinson. There are certain atypical varieties where there is a widespread neurodegeneration and the response to the treatment may not be good and prognosis is not that good. So we call it Parkinson plus syndromes. Then there are certain problems in the brain which ultimately gives rise to signs of the Parkinson. We call it secondary Parkinson, like normal pressure hydrocephalus. Then there are certain white matter changes in the brain, certain mineral depositions, they may give rise to Parkinson-like features, but they are not actually the true Parkinson disease. So for this, we need some form of brain imaging, like MRI. In certain population, we may do some specialized tests also to establish the diagnosis of the Parkinson. But by large, main diagnosis of the Parkinson is by clinical assessment and examination. So this is how we diagnose Parkinson. Now coming to the treatment of the Parkinson. So Parkinson disease is treatable condition. We have very good medicines which control its disease symptoms. We start different medicines slowly and we gradually adjust their dose, because ultimately all these medicines, they act on the brain. So we have to give adequate time for brain to adjust to these medicines. So we start slowly, we gradually increase. Sometimes some patients may need different doses, so we need a close follow-up. We start different class of medicine in different doses so that we can minimize the side effects of the medicines and we optimize their efficacy and effect. Unfortunately, we don't have any medicine which stop the disease progression. So ultimately, slowly this disease progresses, but it is very slow progression as far as Parkinson disease is concerned. Apart from medications, physiotherapy and good nutrition is very important. Physiotherapy is important to maintain the joint posture and the mobility of the patient. So we should encourage walking, we should encourage cycling, and if patient is not able to do in advanced stage, then actually physiotherapy to maintain the joint positioning is very important. In Parkinson per person, there is a tendency to develop frozen shoulder. In fact, it can be a presenting complaint in some patients. So, shoulder movements and shoulder exercise are very important in Parkinson patients. So, Parkinson disease is a treatable condition, and we have very good medicine nowadays. In advanced stage of Parkinson, when medication effect may not, medication stop working, or sometimes there may not be a good response, then we have surgical options also. We call as deep brain stimulation. So it is also having a good results in certain populations. So that's also one of the treatment of the surgical treatment of the Parkinson disease. So Parkinson disease can be controlled and treated by giving various medicines. Early diagnosis is important. Along with that, physiotherapy and good nutrition is also plays important role to improve the quality of life of Parkinson patient. Thank you.